All right. Well, I'm looking forward to hearing folks' questions from the film. I just want to say thank you again to our partners. I'll put the slide up at the end. We'll put some links. We've partnered with a number of groups that are working across the Southeast on these issues. And in the film, there was a call to support those in the community. Nurse Johnny, I think that was you. That said that. And, I encourage you all to check out their websites and see what they're up to and support their work. So with that, I would love to turn it over to Reverend Dr. Gerald Durley, a civil rights icon. I've learned so much from him. He always gets in good trouble. And I've heard him say so many times that these are the issues that are a civil rights issue of our time. So without further ado, take us away.
Thank you so much. And thank you for a very exciting film, because we realize that everything begins, as someone said in the film, knowledge is power. Today, we're very honored to have probably one of the most gifted panel put together to talk to us. Now, what we want to do today, we've got a short period of time, and I'm going to ask two primary questions, and I hope they get at the basic issues to excite you about climate change, mitigation of climate change, what it means in terms of health. Too often, the everyday person misses out on this. But the panelists today, they've got specific kinds of expertise that will help us, and they're going to keep it basic. There won't be any long slide, statistic analysis. They're going to speak from what they know. In other words, this film has created the healing wave. Today is a healing wave where we're going to listen, learn, share, grow. But the last question will be, they're going to offer solutions. So I'm not going to spend any more time. I get excited when I get into this, and everyone has to be excited. It's an enthusiastic time. When we were in the civil rights movement, we understood that everyone had to be a part of it if we're to win. So the panel today will help us with that. And the first primary question that I would like to put to the panel is something that we realize that if any change is to occur, we've got to have the people educated enough to understand it. So what is the problem around pollution and climate change in the Southeast and its impact on everyday people? People who have rent subsidies, people who have police brutality, people who are facing all kinds of other unemployment, poor education, inaccessibility to healthcare. So climate change, we want to elevate it to that next level. So we need people who can really tell us in everyday language. And I'd like to divide these questions up. The first question that I'm posing about climate change in the Southeast, and I would like for Nurse Johnny and possibly Vice President Laura Bender and Dr. Saikawa to do this, and the other panelists will take the second question, but just give us a real picture of what we're facing.
I think I'll jump in, Pastor, if you don't mind. This is Johnny. I'm from Atlanta, and when I say that, for me, it means that I live, work, play, and praise within a 5-mile radius. But since maybe 50 years, when we saw the flight from the city of Atlanta, we've had this limitless suburban sprawl, and we've had this containerized public transportation system that doesn't meet the needs of that urban sprawl. So we've got these infinite rush hours. We've got this ensnarled traffic. We've got 3 major interstates running through our city, through the very neighborhoods that can least afford to stand it. The air quality is devastated. Every summer becomes a season of code orange. We've got the world's busiest airport and all of these big companies that are a boom for the economy, but they produce all kinds of things that are detriment to the communities where they sit. And so if you couple that, the economic boom of the Southeast, the development of the suburban flight that we saw, couple that with the disparities that we already know about, the pre-existing conditions, the poor nutrition, excessive stress, there's no doubt that you're going to see more medical conditions, like I mentioned in the documentary, that our children, and I'm serving 0 to 5 babies, they have medical conditions at the same rate as adults and older adults. That's what it looks like for me in the Southeast, in this transportation hub of Atlanta.
Please join in. We're just talking. Tell us what it's about, what we're doing here, VP Bender.
Sure thing. Thanks so much for having me. So I work for the American Lung Association, and every year we put out a report called the State of the Air Report, lung.org/SOTA. And the whole point is to put air pollution into the language of every day. And so what we do is we actually give letter grades and rankings to communities across the country for their levels of two of the most prominent and dangerous air pollutants, ozone and particle pollution. And so I encourage everybody to check out the results, lung.org/SOTA for State of the Air. What we've found is that we've been doing the report for more than 20 years, and overall air pollution has gotten a lot better. There's a couple remaining issues. One is that there are too many communities across the country that are near polluting sources that haven't gotten cleanup. So places near power plants, industrial sources, major sources of traffic, distribution centers, ports. And of course, we know that those communities are disproportionately communities of color. We're also seeing that climate change is showing up in the report as actually undoing some of the progress that the nation has made. Warmer temperatures, as you saw in the film, make ozone pollution or smog more likely. And high smog days can impact anyone's health if the levels are high enough, but it's particularly dangerous for people with asthma, kids, the elderly, people with other underlying health conditions. And we're really seeing that climate change and its warmer temperatures is making smog pollution worse, including in the Southeast.
So insightful. So it really is something that is here now, not something in the future, because so many times people say, well, I'll get on that climate change board or that climate change bandwagon in 15 to 20 years from now. But from listening to you and Nurse Johnny, this is something that's right now in our midst.
That is correct. We are seeing the impacts right now. And if we take action to reduce the sources of pollution, which pollute immediately and drive climate change, then we can keep it from getting worse.
Dr. Saikawa, speak to that, please.
Yeah, I think it's so true that we are seeing the impact. And thank you so much for having me. So my work is mainly to understand the emission sources and then also to model air pollution. And I think in the Southeast, it's so clear that the heat is getting worse and worse every year. And then as we've been talking about, it's going to make air pollution worse as well. It's going to make particulate matter pollution worse, and it's going to make more ozone. And that's why we are going to see more asthma attacks potentially, and heat itself is going to kill. And so how are we going to make sure that already the under-resourced communities that are under so much stress, having even more stress, that's something that we really have to be able to provide to those people in need.
Either one of you three on this first question that would like to add something that you said. You've got out that first statement now to make it real in the lives, to let us know, just the everyday person, that now, if not you, then who? If not now, then when? What are others? Nurse Johnny, you talked about a couple of things that you see every day here in the city of Atlanta. What are some of those things that really get to you? Because if it gets to our gut, we've got to get it into the guts of the people to let them know how important this is. Take a couple of minutes before we go to the next question and pull that out. Make it real in the lives of the listeners and those on this call.
It's the children down the hall from me. I'm at the school right now where I sit as a nurse. These children are missing days from school. Parents are missing days from work directly because of this environmental impact, this environmental pollution that is disproportionately affecting this community. It's not, I don't see the emergency room trips for children in other communities, communities of privilege, the way that I see in my school, the school where I sit. I don't see the severity of illnesses. And I can't just limit it to the asthma, allergies, and things like that, but it's other chronic medical conditions that I'm seeing that I have never seen in my 20 plus years of nursing at the rate that I'm seeing them here with these children. And I know it's got to be directly related to how they're living, where they're living. It's the interstates, it's the housing, the environmental pollutants in the housing where they are, and that the mitigation strategies, they've been defunded over the several years. Regulations have changed and shifted, and these families are being directly impacted. I shouldn't have to tell parents to roll up your windows. The air quality is too bad for your sensitive child to breathe today. I want you to go to the mall if you want to take a walk. But that's what I'm having to suggest. You can't play in the neighborhood parks because the air quality is so severe today.
Someone else on this first question, you two panelists. You're making it really real. Go ahead, please.
Thanks. I'll pull out one more finding from our report this year. We looked at communities of color and found that they are 3 times as likely, according to our most recent report, to live in the most polluted areas. So I mentioned we give letter grades. We do 3 different types of measures of air pollution. And the communities that got all Fs are among the most polluted in the report. People of color are 3 times as likely as white people to live in communities that got all Fs for their levels of air pollution.
And I'm going to jump in with an audience question. I'm going to take a little host privilege here. We have a question that came in about what's the most effective way for patients and parents of patients to bring attention to health disparities. And I think Dr. Barkan, you and I have had some really interesting conversations and would love to hear what you think. Sorry.
No, I was going to tie that back in, but go ahead. I was going to get them out first and bring that to that question, yeah, in the solution state. Yeah, go ahead.
Yeah, a couple of thoughts are coming to mind. I think the thing that bothers me the most about where we're at right now, and this is not a direct answer to your question, is that we're having to play offense and defense at the same time. So, we need to get into the medical schools and explain to, healthcare providers in training how all of these things we're talking about today impact differential diagnosis. So we're preparing for the inevitable, which to me is kind of heartbreaking, but it's necessary. We also need to play offense. And I think some of the policies that we're seeing being rolled out now are encouraging at a federal level. In terms of bringing, highlighting the health disparities, the thing that I think is also a challenge is that, we're preaching to the choir a little bit here, right? We all understand we have the luxury, the mental space and the resources to think about climate change, right? To entertain, well, why don't I feel good when I'm outside? People that are struggling, have several jobs, or just surviving, are not thinking about this the same way. It's not their fault. It's endemic to the situation they're in. So I think in terms of highlighting it to kind of the everyday person who's not in science or in environmental activism or anything, I think asthma is actually a great route, a great vehicle, because like Johnny said, what I think they quoted in the film, 27% was that greater Atlanta area. That's striking, right? So if you can explain to the mother that's now her 4 children have asthma, the connections, that's helpful. From a, unfortunately, playing defense standpoint, you can check the air quality every day. And like Johnny said, I think it's unfortunate too, because, I tell this story often, but a couple of years ago, my son was telling me at recess, he didn't feel good, like every day when he went outside. And I know what that is, because I have the same issue when it's really hot out. And that part of it kind of makes me sad. So I think we're playing defense and offense at the very same time right now. And in terms of communicating it, we know that education is the #1 driver of life expectancy. It's not money, it's education. So I think because of asthma is so prevalent and the SES groups that it affects, one way to reach them, I think, is through asthma education as a good vehicle to make the connection, because people are not making the connection between air pollution, climate change, and health. Those 3 dots need to be connected.
Dr. Padgett, it goes right into the second question that Dr. Barkan was talking about, this institutional racism. When I look at 85 miles of the pollution, Cancer Island, as we call it, Cancer Island in Louisiana, where people are disproportionately being impacted by power companies by polluting the water and the air. We see those kinds of efforts in play today. And we know that legislation is a part of what Dr. Barkan was talking about in terms of educating the people, but legislation moving parallel to get to that undergirding factor. You've been working with historically Black colleges for some time and these young people. Can you speak to that? How this institutionalized racism, and I saw it in civil rights and human rights when we fought for the right to vote. Now we're fighting for the right for clean air and clean water. Those are constitutional rights for all Americans. So how do you address that when you're talking to your students?
Yes, well, interestingly enough, research is showing now that there's a connection between communities that were redlined and urban heat islands and particulate matter 2.5 exposure, which is really, an an insidious, coming together of past ills. And so I guess most of us may know that, the whole redlining practice was rooted in federal government policy. And we can go back even further and look at the urban renewal program that devastated a lot of Black communities and resulted in the creation of these areas of concentrated poverty in public housing and subsidized housing that also happen to be next to highways or next to industrial facilities that were in the close into the downtown of many urban areas. And then we had, of course, the filtering that occurred when the largely white immigrants moved out away from the plants, and African Americans and Black and brown people filtered in and are still there being exposed to air pollution. And so I have to really inform my students, because this generation, maybe not even the generation before, is not really familiar with redlining, certainly not urban renewal, and how those urban planning policies could have a direct connection to health is just really brings a lot of attention. In terms of solutions, Tennessee State University, our motto is Think, Work, Serve. We are providing technical assistance to the communities and helping them to put low-cost air sensors in communities that are impacted disproportionately by poor air quality. We've also been doing community education workshops on urban heat islands, and young people are really aware of the fact that they live in communities that have elevated heat that exacerbates asthma and other respiratory problems, and how to, again, use these low-cost air sensors as a means of community-based education and research. Although we're a little ways away from having federal government acceptance of low-cost air sensors as being valid data, but still we can use them to inform our communities and at a local level that our air quality is not acceptable.
Do you think, not just you, but any panelists, do you think just by educating the people, Dr. Bennett talked about, Barton talked about, if we talk about asthma, we see the asthmatic conditions, we see the cancer, we see other kinds of illnesses and sicknesses that were discussed in the film. Do you feel that just by educating people about the illnesses and the sicknesses is so preponderant around us that will bring them to the level of getting actively involved in changing legislation, in changing how we live a simpler lifestyle in terms of the pollution in the air? Is that what we need to do now? We're moving towards solutions. Do you think that people, everyday person has now reached a level of, if we give them the right information, they'll get on board and we'll have a massive change? Do you believe that that's a possibility? Is that real? Or are people still, I've got to pay my rent, I've got to get involved, I got to just work here, rather than this scientific up in the air discussion about climate change? Do we get into Paris Treaty? What are they doing overseas? How do in Chicago, in Detroit, in Nashville, in Atlanta, you all are the panelists. How do you take what you know, your passion, and give it to us?
Yeah, well, I'm personally seeing that happen. I'm working with communities in Houston, Atlanta, Washington, D.C., and once they become more aware of their local air quality as opposed to what is captured by federal monitors, which there might be one or two in each city. Yes, there's Dr. Nataki Osborne right there in Atlanta who's working on an urban heat island campaign. There's also, I'm working with the Air Alliance Houston, where there's a massive campaign in Houston, which is the city that has all these, the most petrochemical industry facilities in any other city in the United States. And those communities are constantly exposed to both acute and long-term exposure to air toxins. And so, yes, I mean, the answer is yes. I mean, once people get the knowledge, and another thing that we're working on is there are tools that are provided for grassroots organizations, such as the Environmental Justice Screening Tool. The Centers for Disease Control has their places. You can go on the places, CDC Places website, and go down to the census tract level and look at where asthma is more prevalent in one community versus the other at the census tract level. And so that's another thing, is to take the tools that are available, put them into people's hands. And once people get a little bit of education on how to use these tools, such as EJ Screen, in Viral Atlas, the Places tool, and then there's Cal and Viral Screen, and then there's all of these tools empower people.
Dr. Bender, Vice President Laura Bender, you over the lung and so, does that make sense what he's saying?
It does to me. I'll say, so I think from at least my experience working with volunteers, the country over, people get it. Sometimes people need, a bit of background on the health impacts of air pollution, but then they can immediately connect their experiences. They're the experts in how to engage in their own community. Where I come in is often to make sure people feel comfortable speaking up to their decision makers at higher levels, particularly in the halls of Congress and at the federal government. And my message to people is always, you are the expert in your story. Their job is to work for you. Not only do you have every right to be there meeting with them, but it's critical that you do, because at the end of the day, you're the person they want to hear from, not me, the staffer working out of Washington, DC. So I'd say, yes, education combined with just a little bit of practical knowledge and how to communicate with decision makers, and people they get it and they're ready to go.
Put your questions in the chat box to this expert panel right now. Don't lose this opportunity to talk to people who know, who are involved, but most of all, who are passionate about what they do. As a psychologist, I was interested in what Dr. Barkin was doing in terms of the psychological impact of individuals and who are involved with this. I heard that you might be creating some kind of instrument to look at the psychological part of it. I believe that we're in an ethical and a moral battle with the business community, the political community, and the scientific community is kind of hanging on. You face the psychological issues from what kind I can understand, Dr. Barkin. An instrument that you put together?
Yeah, we have a draft version of it now. And what we did was we took what's called a patient-centered approach. So instead of, a group of academicians going in a room and, looking at the literature and trying to develop these items on a questionnaire, we went to the population that's experiencing the condition of interest to develop the items on the questionnaire. And you can do that through focus groups or individual interviews. So what we did was we looked at like a cross section. We interviewed farmers in Georgia and Florida. We interviewed coastal Floridians and mothers to kind of get some different perspectives on climate impacts on mental health. Each brought like a different perspective. The farmers really were worried about finances, crop yield, these long stretches of, either drought or rain, all the things that impact their ability to have a thriving business and also keep their employees employed. So that was a major theme with the farmers, which we expected. The mothers, are worried about things like, when my kids grow up, will there be any animals? These things that as a mother you work. That's actually what got me interested in this, is me as a mother worrying about, are we going to have to leave Georgia because my asthma's gotten worse? But I look at where I'm from in Pennsylvania, and their weather is completely topsy-turvy. They're 90 in the 95-degree range for about a week. So I mean, I don't know that there's any panacea, but the other group that we interviewed were coastal Floridians, and they brought in the community and advocacy aspect. There were several from Catalyst Miami. I don't know if anyone's ever heard of that, but I was really impressed actually with their level of literacy and preparedness around talking to legislators and understanding community readiness to deal with climate change. But the long and short of it is, yes, I think eco anxiety, that kind of got its start in the mainstream media. Science is now catching up. we're recognizing we need to be able to actually measure it, right? Like quantify how anxious is, how distressed is somebody due to climate change. And a lot of that is impacted by, it's a number of different things.
Before I ask Nurse Johnny to close up with the passion, I love people that get excited about this. I could have cared less about a polar bear and trees and all of this 10 years ago. It was just something that was around. I thought that people had the money, they had enough time to go out and look at birds and trees and talk about the air. But now I see that it's real. Before I ask her to close, I'd like to ask the academician. We talked about the academician up at Emory, the environmental science people. Are you all coming? How are you now? Are you making it? You've got all the information, you've got all statistics, you work with the CDC and Sierra Club and all these clubs. What are you all doing now that's, in your estimation, that's bringing it down to the everyday person? Dr. Saikawa.
I thought it was going to Nurse Thomas, but okay.
She's going to close it out. Get ready, nurse. Get ready, nurse. And when I say close it out, we got to close it out because I see the smiles on people's faces. I am so sick of being around dull environmentalists, dull conservationists. We are competing with the Atlanta housewives. We're competing with television shows. We're competing with the pandemic. Let's get excited about this. You can't win unless we say, and I mean, take the knowledge, take the science, take the economics, take the politics, and be excited. So she had the passion to close out, but I want to hear an academician.
Yeah, sounds good. So I wanted to mention about a very small project that we were going to start because of urban farming that was going to blossom in Atlanta. I'm looking at air pollution from agriculture, and then we realized that there's going to be a lot of urban agriculture that's going to happen in Atlanta. And then realized that there's actually no regulation in the city to test the soil before you grow food. And so we ended up testing the soil and then found enormous amount of lead in Vine City in Atlanta. And that was 3 times higher than the EPA threshold. And that led us to think maybe this is not just in one place. And then when we came to talk with EPA and then we worked with the community historic Westside Garden members, we found out that in Vine City, there was a mound of slag dumped in the neighborhood. And so that was industrial waste creating a lot of pollution at that time and now causing so much soil pollution, soil contamination in this very much overburdened community. And now it has become a Superfund site with 2097 lots. And we don't know what the boundary is. And in those neighborhoods, people did not know about soil contamination. So talking about awareness, I think it's so important. So much is linked. It's not just about air pollution. It's not just about soil contamination, but what they are cumulatively exposed to is something that we really need to care about because we cannot just deal with things separately. And this is what air pollution, climate change, soil contamination, how everything is so linked, animals, plants, and everything is just all together.
Look at that excitement.
This complex issue together.
Everything is linked. Nurse Johnny, could you give us 2 minutes? Then I want each panelist to give us 1 minute. And I've got my clock right. No, I don't have a clock, but I've got something over here. Closing each of the other 4 of you, because you've talked about the heart and soul of what we see every day. What I see in the pulpits and in the synagogues and in the mosques that I travel around in an interfaith, I chair the Interfaith Power and Light throughout America. And I see this in all the 22,000 houses of worship that now we've got to come together with science and business and politicians. So if you could, and then each panelist, you have a minute just to say to this listening audience out there, what you think that they should do. Yes, go ahead. Give me 2 minutes and I got my clock running.
I think it's really important to make note of what was said kind of concisely, that my proximity, how close I am to industrial pollution and waste and air pollution is too often related to the color of my skin and my socioeconomic status. And so that's real for me. When I talk to colleagues of privilege and they tell me that they don't know anyone directly that has died from COVID, while my timeline, my social media timeline is filled with live stream homegoing services, invitation to graveside services. This is real when there are several people on the same street that have developed cancer. This is I'm not a big proponent of awareness campaigns because I don't know how effective they are. But in this instance, I think that's what we need. We've got to beat the drum. We've got to be vocal voices, sound the clarion call, ring the bell, tell people, make those connections for them that the lethality of COVID in our communities, the prevalence of all these medical conditions in your neighborhood is because of these factors. We want to be good stewards of our environment, of this planet, but we can't do it if we have no awareness.
Thank you. Minute, Dr. Padgett. What can we do as everyday citizens to go toward mitigating this climate change and bringing it to the reality from your perspective as an academician and an environmentalist?
Yes, well, on I guess looking at a long arcing term solution, we are African Americans, only 3% of medical doctors. We're only 10% of teachers at the K through 12 level. And probably within that group, very few are actually science teachers. And so historically Black colleges and universities produce half of Black teachers. And I'm part of an initiative right now to collaborate with HBCUs and our College of Educations and our science, technology, engineering, and math faculty to get more of our education majors to consider being science teachers, to go into these classrooms. And as they say, if I can see it, I can be it. So that our children can see someone who doesn't necessarily have to be a scientist to teach science, but can, make these children from a very young age see themselves as being climatologists or epidemiologists or atmospheric scientists in the future. So that, like I said, that is a long-term solution that we can get students, parents, educators, and everyone to build a massive army of African-American kids who will eventually 10 years or 15 years from now, we won't see these deficits in STEM that we see now, because it's science, technology, engineering, and math, which is largely where the solutions are in this fight in environmental injustice. But we are clearly at a deficit there.
Thank you. Dr. Barkin.
So what can be done at the individual level? One of the themes that came through when we interviewed people about climate distress and what makes them more distressed and what makes them feel better was agency. So doing your part or taking some action to address, whether it's recycling or composting or, buying an electric vehicle, that made their distress not go away, but it mitigated it to some degree. That said, I think we also need to be mindful that there's a stress. If you place too much of the responsibility on us as individuals and citizens, there's a stress that comes with that. Because the thing that probably makes me the most nervous about this is what this requires, because in my opinion, it's the biggest public health crisis we've faced, is a global coordinated political will. And that part, I guess, is the thing I don't have the answer to yet. But in terms of management of your own anxiety, using these tools around air pollution, understanding, where you live, kind of if you're at high risk of extreme weather events, the playing defense part is something that you can do. And also, taking small steps to empower yourself is definitely something that helps lessen the load at an individual level.
Thank you.
You're welcome.
Laura Bender.
Of course, check your air quality. EPA has a website at airnow.gov. There are not monitors everywhere there should be. And I know I saw in the chat that some folks, particularly in the West Coast, have found individual sensors to be helpful too, but check it. Number two, totally agree. We cannot put the burden on citizens for solving the climate crisis when we need action at every level. But for people that do want to take individual action, I totally agree that it's empowering. We have tips at lung.org/AIR, AIR. I know there are lots of great other resources out there as well. Third, talk about climate change as a health issue. We know that people care most about climate change and are most inclined to act on climate change when they know that it affects their health or their family's health. And I think all of us here get it, you watching get it, so let's spread the word. Fourth, of course, advocate. This is a critical moment on the federal level. Congress is considering legislation. It could be a good opportunity to invest in cleaning up the pollution that causes climate change and causes health harms. or they could miss it. So let's call on them to take it. And President Biden has announced a series of proposals and initiatives that could reduce air pollution and further environmental justice, but he needs public support to make sure that we see it through at the levels that we need.
Thank you so much. I think you pretty much summarized it, didn't you, Dr. Saikawa? Did you have something that you wanted to close with?
No, I'm good. I also put a comment there. So I'm hoping to work with Veronica on putting the sensors up so that we know at the final scale. So if there's anybody, please contact me.
Thank you. Thank you. On behalf of mothers and others, let me thank all of you. Please forgive me for moving it so quickly. I know that you had so much. If you ever want an assignment, get 5 professionals who are passionate about something and squeeze it into 19 minutes and get everybody in. It is not easy and to be a friend. But we want to thank you. I've coined a new phrase that you all can steal. The phrase I've come up with is not pandemic, but we are after the pandemic, we're going into a climatemic. And the climatemic is no vaccine for a climatemic. It takes all of us to come together. You can't get a vaccine for a climatemic. We just got to start practicing and how to mitigate against those things that people have said today. Veronica, thank you so much, and Mothers for Others for what you all are doing. It's yours.
Thank you. I'm sorry. I was trying to interrupt with audience questions, but it was such a great conversation. There were a couple specific questions about a study Dr. Barkin mentioned. So Dr. Barkin, if you could pop the study in the chat, that would be great. There were some questions about if we're going to share this. We are not going to reshare the broadcast with the film part, but we will rebroadcast the Q&A panel part. The film is still not publicly released, but it is available for streamings. There was also a specific question about exposure from airplane traffic and transportation nodes and increasing the smog in areas. And I think we touched on some of that, but I didn't want to miss that from the audience. So if any of the panelists have thoughts, and then there's a couple of more questions, and I think we have a few more minutes if we can squeeze them in.
Real quickly, I'll type a couple lung association websites that I mentioned into the chat in just a moment. I'll say that collectively, transportation is the biggest source of climate pollution. And so that is not only the cars we drive, it's, of course, our trucks and delivery vehicles, but it's also our aircraft. And so they're absolutely a contributor when it comes to the carbon emissions that drive climate change.
Thank you, Laura. And then there was another question here about how the urban planning and legislation have an impact in office setting, the impacts of air pollution and climate or disproportionate air pollution.
Yeah, I guess a lot of the problems that I see are related to zoning and the lack of participation thereof historically. And so becoming more active on boards of zoning appeals, or just looking out for zoning changes, because too many times we wake up to land being changed from residential to light industrial, and the next thing you know, you have some kind of a medical waste incinerator in your neighborhood on land that should have been residential. And so yes, urban planning or lack thereof is a big issue with regard to exposure to air pollution.
Great. And then there was a comment earlier when we were having the conversation, Nurse Johnny, I think you were saying recommending people walk inside because the air quality is so bad outside, and someone flagging that indoor air quality in some cases often is worse than outdoor air quality. And so just wanted to throw that out for conversation, and I'll post in the chat. We've just released an healthy breathing indoor air quality toolkit that covers 13 different areas of how you can make sure your home is not adding pollution. But I would love just a few final comments on that, and then we'll wrap up. I think we got to all the questions. Anyone on indoor air?
So the indoor working out thing is a great suggestion on the days when we have those code orange and code red days here. But I agree, get outside as much as you can.
Too, I think when we think about indoor air quality and water quality, we have to try to work in, and I think this is hard because technology is expensive. Keep in mind that not everybody can afford a better filtration system for their water, or, to swap out their gas burning oven for an electric. So I think that's a part of this whole circular problem, is that, the more resource you have, the more choices you have. So I think, we're advantaged, and we need to kind of fight for those that, don't have the luxury of fighting for this particular topic right now.
Now, I'd like to add another little piece is that I'm running across a lot of young people. Atlanta is wide open. Your clubs, your eating places and all. And I ran across a couple of people come up to me and ask the question, Dr. Durley, do I have to wear a mask inside? I've already had my shots. And a couple of people felt a little guilty. They said, well, I'm going to wear mine anyway. I don't care what anybody says. And I have to explain, do not feel guilty. If you feel comfortable, wear your mask, and give them the freedom to put on their mask if they want to put on their mask. But a couple of them said, I feel like I'm condemning the other person because I'm wearing a mask and they're not. I said, no. So we've got to be cognizant of saying those things to people so that they can feel comfortable whether they put it on or take it off. Inside or out.
Absolutely. And I will say, Dr. Ann, our medical education advisor, did a great blog recently on how most of the masks people are wearing are not protecting them from air pollution. So I would encourage you to go find that on our blog. I'll also just say one last time, thank you all so much. This is such a wonderful conversation. So many great questions. We have another event June 15th. Panel discussion moderated by Reverend Michael Malcolm, who is a mentee of Reverend Dr. Durley. We are hosting Dr. Robert Buller, the father of the environmental justice movement, and we're having a panel discussion with Queen Quet of the chiefess of the Gullah Geechee Nation, and Dr. Christina Fuller, Hemphill Fuller from Georgia State University. So you can find that on our homepage on our website, and we encourage you to join us for that. That will not be rebroadcast. It's a one-time only event. Dr. Buller does not allow his speeches to be recorded. So we look forward to seeing you then. And thank you all so much. I'm seeing great panel and wonderful
And
comments.
remember, I always like to close with, remember this, we're on the winning team. We're on the winning team. I don't get on losing teams. I don't get around losing people. We're on the winning, and thank you, winning team. You are the healing wave of right now. Bye.
Yes, healthy air is healthcare. Absolutely. Thank you all so much. Thanks for joining us. Bye.
Thank you.